I understand that there is a lot of concern about hepatitis B and hepatitis B-induced liver disease. This concern is probably because there are about 300 million people in the world who are affected with hepatitis B, and at least 35 active disease patients which we are seeing daily life in the world. And every year there is about 3.5 million people who are dying of liver disease secondary to hepatitis B. But there is something which is truth and something which is fiction, and there is a lot of erroneous or wrong information that's going. That's what is bothering us, our medical fraternity, that the wrong information is making a lot of confusion, and the facts and fiction both are joining together, and it's giving us a lot of confusion. So it's my responsibility or our responsibility to see that the misinformation or the wrong information should be cleared through this message. Let me clarify. What is this hepatitis B virus? Hepatitis B virus is like any other virus. It's a DNA virus, and it goes into the body, and it is specifically affecting the liver. That's why it's called hepatitis virus. It's a large virus. It can't go from the mother to baby through the placenta. So it's a large virus. It's infected by the blood and sexual tract, not by saliva or touching or food or any means. And it gets transmitted definitely by injections or sex or from the mother to the baby. So if you look at these developing countries like ours, the major transmission is through the mother to baby. If somehow we can stop this transmission from mother to baby, and we can conquer this disease of hepatitis B. You understand that there is what is I mean by myth, or is you understand that this infection cannot be transmitted by a social kissing or touching or using the same utensils, but definitely it gets transmitted if you use the use brush or shaving sets, and then if there is a malpractice or parental or drug abuse, or people who are using some hemodialysis or catheters, they should be extremely cautious that this hepatitis B is a resistant virus, and it should be taken utmost care before we are using the same instruments in reusable instruments. The key factor, what I said, is mother to child. When does this mother to child? Not during, because I told you that it's a large virus, it will not get transmitted from the mother to child. It gets transmitted at the time of delivery. So just assume that mother is vaccinated, that she is protected against hepatitis B. Then there is no way that the mother can transmit the infection to the child. So suppose we miss that. If the mother is mother, still she can stop transmitting the infection if the baby is protected on the day of the delivery. Fortunately, we are in such a place where government recognized this, and they started giving a vaccine at the time of the birth, at the time and the place of the delivery. So this, and followed by a complete vaccination schedule of 3 injections apart about a month, along with the other vaccination schedule, then your child is protected forever in life. Simple best practices at the time of the delivery is also important. You need to know that if you go to an A&M or some maternity assistant at our home delivery, can't do all this. If you have a best practices at the time of the delivery, there is no way that then your child can get this infection. Don't think that the breast milk can transmit infections. Breast milk can never transmit infections, because this hepatitis B virus is a large virus. It cannot pass through the milk. So what if the patient mother is HBsAg positive or hepatitis B positive? Then you are not lost. All that you need to do is go and meet a doctor who has knowledge about hepatitis B, or choose a doctor who is a hepatologist or a gastroenterologist. Get the test done, get the proper education done, clear your doubts. If there is uninformed or wrong or misinformation, then you have to do such as, classical example is, I do get patients, mothers saying that, sir, I'm hepatitis B positive, I need to break to my child, or I have to get aborted because my doctor told or my neighbor told to stop this delivery. That's not true. In no way mother can transmit the infection to the child as long as it's in the body. At the time of the delivery, because of the contamination, the mother blood and the child blood, there is a cross-contamination and transmission. This is the major reason or a major way of getting infected, and the whole country is getting affected because of this improper practices of delivery. And see that if the mother is hepatitis B liver disease patient, see that there are drugs which are available, and all that she needs to do is use the tablets in the last trimester, means just 1 month ahead of delivery and maybe 1 month after the delivery, so that the baby is protected forever in life and the baby is completely free of hepatitis B. If you are an hepatitis B positive, then what is that you need to fear? That all hepatitis B positive patients or individuals are infected and diseased. There is a lot of debate is happening on this. Can we call hepatitis B positive or a surface antigen positive person, HBsAg positive person, as a disease? There are many people who believe, including me, that these people should not be named as a disease. They are asymptomatic hepatitis B surface antigen positive individuals, not disease or patients. So this is the thing that there is a lot of debate. We do agree that all patients who are HBsAg positive, I mean to say that there are 350 million people are diseased. They are infected some part of their life. You have a protective way of a body which takes care of the hepatitis B infection once we get infected. Classical example is, you know that the patient hepatitis B jaundice patient, that means your body is struggling to fight, and then probably it victoriously comes out after the down the line 3 weeks and get rid of hepatitis B from the body in 3 weeks in 90% of the individuals. Somebody can cash out of it, but without we doing anything, HBsAg positive individuals who are infected individuals who develop jaundice, that means their body is fighting against, because the inherent strength in the body, within the body, is fight against this virus, and during the process they develop jaundice. They don't need any treatment. All that they need is simple rest and support. What we are confused is, when the patient is jaundice, the person is jaundice, hepatitis B, then we take that these people are going to die, are going to have some infection, needs to take some treatment. It's not true. 90% of the adult individuals, only 10%, unfortunately 10% individuals need an assistance from the medicine. There are available drugs, there are available medications, there is an available supportive therapy, including in case less than 1%, maybe less than 1 in 100 needs a real support like liver transplantation. Very, very unfortunate. But still, this is also available at present to all our patients. But very fortunately, there is only few percent of the patients, that means less than 1%, who requires all this. But otherwise, 90% of the individuals by themselves, they get rid of, adult individuals get rid of the disease. Having said that all hepatitis B subjects are not infected, not diseased, but certainly there are few percentage of people who are infected, who are diseased, who are unattended. They do not know that they are suffering with the disease till the end stage of the liver disease. What is we need to do in these circumstances is we need to identify and meet a right doctor, and the right doctor will give a right advice and right things for the patient, and also protect the whole family, that without knowing that he might or he can transmit his infection to the entire family as well as the outsiders. So what we need to do in such situation is, all that you need to do is evaluate the liver for any liver disease and evaluate the hepatitis B virus by doing a DNA test. A DNA test can identify how many viruses are affecting our body and what can be done in such circumstances. We have various means of doing testing these people and identifying them at what stage they are, and then we can treat them. There are available drugs. There is available injections as well as available tablets. The tablets, Indian government has brought it to so low that each person can afford, with 1,000 rupees a month, they can afford treatment for hepatitis B. don't get carried away that hepatitis B is not treatable. Hepatitis B is treatable, and even if the patient is in end-stage liver disease, we still can prevent hepatitis B-induced cancers. This is one of the most worrying things, that hepatitis B can produce cancer, but this also can be delayed or prevented by using treatment. There are available tablets, enough of the thing. Government has taken all the precautions to provide treatment for all individuals, and through various means they are also supporting the treatment for hepatitis B unfortunate diseased people. Only thing we need to do is do things in a right way and in the right time. We can protect ourselves and also from our children from the future infection. Suppose we identify or we come to know that the person is hepatitis B induced liver disease. I am certain that once we identify, everything in the right direction can be done. But if you ask me that can't we avoid this situation, definitely big yes. The yes is because we have one of the good vaccines which are available for more than 30 years. What is most distressing and unfortunate is the vaccine which is safe and available more than 30 years, we were not able to use the opportunity to prevent or overcome this infection, unlike Taiwanese. This is one of the classical examples in the medical history how Taiwanese people, the entire country is vaccinated against hepatitis B, and they are supposed to have high liver disease with hepatitis B, high children infected with hepatitis B, high evidence of liver cancers in childhood. They're all wiped away with simple vaccination. And I should mention that government has brought the vaccination to the cost of dose of about 20 rupees, and they made it freely available in spite of the best efforts from the government. We should recollect that AP or Andhra Pradesh government is one of the foremost states to take this vaccination as a good thing into the expanded program of immunization, and they made it available for all children, including rural children, free of cost from way back 2005. And this is initiated by Bill Melinda Gates Foundation. They started giving vaccination free of cost, and they saw that this has implemented for a couple of years, and then they handed it over to the AP state government. What did we do? We checked the people and neighboring states as well as our state people and checked their status or immunity by predicting their immunoglobulin levels in their body. This is called anti-HBs antibody. We have evaluated these children who are vaccinated in the rural area, thinking that whether it's really effective in the field or not. We have done some pilot studies. We found 90% of them, our children, are protected compared to 26% of neighboring states. It's a great achievement from the state government of Andhra Pradesh. And as a responsibility, we, Department of Gastroenterology, started a program called Habib. Habib is after our teacher or a father of hepatology in Andhra Pradesh, Dr. Habibullah. And the name Habib stands for Aware, Educate and Eradicate Hepatitis B for better. Aware, educate and eradicate hepatitis B for better. You need not be a doctor, you need to be a person. You need to be a person who has to have the feeling that we have to do something good. We have to give back something to the community, and we together can make hepatitis B free Visakhapatnam. That was our motto and that was our goal. And then we have been vaccinating, apart from the government efforts, all the children, all highly risk individuals. I mean, what this high risk individuals means, those who are getting dialysis, those who are in the professions that they deal with patients, like nurses, medical professionals, lab technicians, those who are in the jail, those who are in the mental asylum, those who are supporting social service workers. All these people should be vaccinated against hepatitis B, even if they are adults. And with this, our motto, with this goal, probably we can make hepatitis B free Visakhapatnam. The same thing continues as like viral, you can completely eradicate hepatitis B from India and from the world and make hepatitis B a historic disease like polio, like smallpox. And the day is not very far. Only thing is aware and educate, eradicate hepatitis B with vaccination. Thank you.